In this 3-minute video, I will show you how the current biopsy needle design causes infection in prostate biopsy, introduce a novel needle design to address the problem, and describe 2 randomized trials evaluating the novel needle. I am Andreas Forsvall. I'm a Swedish urologist. I also own the patent rights to the needles described in this presentation. The cause of infection in prostate biopsy is the introduction of bacteria by the biopsy needle. It is hence a needle-induced infection. The currently used biopsy needle design was introduced in 1969. To our knowledge, this is the first attempt to address the very root of the problem, the biopsy needle itself. First, we evaluated the current needle design and found that it has a forward-facing opening, very likely to collect large numbers of bacteria. Please note the red arrow. It shows the opening of the needle that acts like a shovel collecting bacteria. Here you can see the bacterial containing fecal matter collected between the needle parts, visible for the naked eye. After a lot of work, I invented a modified needle called the Forsvall biopsy needle. It features a closed tip that makes it completely smooth on the outside. Basically, it came down to making the tip a little larger, so it aligns with the rest of the needle. Using colons directly after surgery, we then simulated transrectal biopsy in an ex vivo setting. The novel Forsvall needle design was compared to the standard TrueCut needle used worldwide today. 200 needle punctures were made in 4 colons, and the cultures were taken from the needles to quantify bacterial translocation into tissue, simulating transrectal prostate biopsy. Puncture sites were randomized and evaluators blinded. The Forsvall needle design reduced infection-causing bacterial transfer by 96%. This was published in Scandinavian Journal of Urology last summer. However, a needle must also collect adequate amount of tissue to ensure diagnosis. We therefore conducted an RCT with 20 patients who were randomized to biopsies using either the Forsvall or TrueCut needle. 119 and 130 biopsies were taken with the Forsvall and TrueCut needles. The Forsvall needle collected almost identical biopsy sample length as the standard TrueCut. As you would expect from just changing the tip diameter and design, patient experience and side effects were similar. In conclusion, we must have the right tools for the job. A novel biopsy needle design may reduce the risk of infection in prostate biopsy. Thank you for your attention.